Hey guys, and welcome back to XL Medical Spa. Today we're going to go back to the basics and talk about Botox. I've talked about Botox multiple times. Check out numerous videos. I'll put it all in the link in the description. But what Botox is botulinum toxin. And how does it use? And how do we use it for aesthetics? So what it does is it temporarily paralyzes certain muscles in our face, sometimes in the body. Body is more for medical purposes, but for the face, we're thinking about wrinkles. The way we develop those wrinkles is every time we make an expression, we make that furrow. Every time we lift our eyebrows, we create those wrinkles. Every time we smile big, we create these crow's feet. So what Botox is doing, it's not actually fixing the wrinkles. What it's doing is preventing the muscles from contracting, and that contraction is what causes the wrinkles. So if I'm limiting your ability to frown, so over the next 3 months, you can't actually physically frown, then your body will fix those wrinkles pretty well. The common analogy I use here in office is think of pillow marks. When you sleep on the side of your face, when you wake up in the morning, you have all these lines because you're actually physically creating those wrinkles or creating those lines. Throughout the day, what happens to those lines? They go away over time. Just like these wrinkles. If we don't make those lines, they'll go away over time. But specifically what I want to talk about Botox today is building up tolerance. And then how do we combat that tolerance so we're not overusing Botox? And then also, we want to make sure that Botox works for you. Okay, so what is Botox tolerance? Now, there's actual medical tolerance in regards to your body building up antibodies, little things that attack foreign substances in your body. So when you put Botox in the body, your body's like, hey, what is going on? We don't like that. We don't want a toxin in our body. So your body will build up antibodies to fight those. So now what happens is if you inject Botox and your body throws in so much antibodies that it gets rid of all that medical toxin that we're using to reduce the wrinkles, reduce the muscle contraction, and then you're building up tolerances. So it's a constant battle. We're putting in more medication, your body puts in more antibodies. We're like, oh, it's not working. We'll put in more medication, more antibodies. So it's a constant battle back and forth. So with that, you're building tolerance because you just do not have enough botulinum toxin in your body to paralyze those muscles. Now there's another part of this where we think it's tolerance, but it may just do with partly genetics, but also how healthy and fit you are. You have to think about how strong those muscles are. Yes, we're looking at the wrinkles and we're treating the actual physical wrinkles itself, but imagine a very young bodybuilder. Every day, in and out, he's scrunching his face, building those muscles. Those are very, very, very strong muscles. But the wrinkles may not be so bad because he's young. Throw it on the other side, 60, 70, 80-year-old, well, the muscles aren't gonna be that strong. You've atrophied your muscles over time, but those wrinkles are very assertive. So the amount of units that I'll put in that 60 to 70-year-old is going to be a lot less than the units I put in the young person. Now, is that tolerance? No, it's just in that young person, even though they have less wrinkles, they have to combat all that muscle mass that's in their face. Whereas in the older person, they don't have as much muscle mass. So we may associate it with tolerance, but really it could be just the amount of muscle that's there and not the wrinkles. Now, what causes tolerance? A couple things cause tolerance, but what we want to do is we want to follow the recommended guidelines from Botox, from Dysport, from Xeomin, from Jeuveau, whatever the manufacturer is. We want to read those guidelines and try to adhere to them as best as possible. Now, for most of these products, we say the recommended dosing is, well, we don't want to say the recommended dosing because that's going to be different for everyone. But what happens is more about the timeline. You do Botox every 3 or 4 months because what happens if you do it in a shorter timeline, that's when your body can build up tolerance. You do it once, even if you think you need more, we'll follow up in roughly about 2 weeks or so, but you come back in about 3 or 4 months. At that point, we can make a change into the dosing. You need more, you need less, things like that. But let's just say you do it once, and then a month and a half later, you're like, it's not working as much as I want it to. You don't want to treat it again because now we talked about antibodies. That little war between antibodies and the botulinum toxin, they're fighting each other. How much antibodies have you built up in that time? Now, if I throw in more, your body's going to build up even more antibodies versus letting all that toxin wear off, all that toxin go away, and then we redose it again. So the recommended timeline is anywhere from about 3 to 4 months, and you don't want to treat it a full dose within that timeline again. The other thing is genetics as well. Let's just say genetically you're built a little bit different, and you fight foreign substances, foreign medications a little bit differently. You're just that person that builds up a lot of antibodies, and you just want to attack anything that's not supposed to be in your body. So genetic does play a role in it as well. For the most part, it's really that timeline. Stick and adhere to that 3 to 4 month timeline, and you'll reduce the potentials of tolerance. Now, how do we avoid tolerance? We just talked about it previously. Adhere to the guidelines, we adhere to the recommended timeline. But now the other thing is, how do you take care of yourself? Botulinum toxin, Botox takes care of one aspect of it, which is the muscle contraction. But how do you also take care of your skin? How do you reduce wrinkles in other ways? That's where skincare comes in. Your lifestyle, your diet, how you animate, how you sleep, all those things will play a role, because animating by itself doesn't cause the wrinkles. Sun exposure will accelerate the aging process. Not using skincare will accelerate the aging process. Sleeping on your side of your face will cause all these wrinkles that aren't necessarily fixed by Botox as well. So Botox is just fixing one portion of it, the muscle contraction. Lifestyle, skincare, how you take care of your body on the inside is all going to play a role as well on how you can reduce the wrinkles and also reduce the tolerance, because you're not going to be using Botox as much. So in conclusion, Botox is a medication. It's a medication used to reduce muscle contractions, going forward to reduce wrinkles. Now, because it's a medication, we can always build up tolerance. Like any other medication, you use it too much, and you're going to have side effects to it as well. And tolerance is one of them. The other one is overdosing. Well, you can't. It's hard to overdose on Botox, but there is a limit on how much you can do within a certain amount of timeline. We also talked about how to reduce tolerance, how you take care of your body. Genetics plays a role, skincare, sleep, diet, how healthy you are, all plays a role as well. So follow the guidelines, try to stick to it. Even if you think you need more within a condensed timeline, just wait it out, talk to your provider. Don't go and try to go other places and lie and say you never did Botox before, or you're changing the timeline. So truly try to stick to it, and then that will give you better results in the future and reduce of any issues and side effects that you may have from not adhering to the guidelines. I'll see you guys on the next episode. Bye.